Hello, my name is Will Lemon. I'm a graduate student at Jacksonville State University, and this is a PowerPoint presentation for my DNP project, The Effects of Increased CAM-ICU Delirium Assessments on Patients in the Surgical Intensive Care Unit. So, introduction into delirium. It's an acute syndrome of the brain that affects patients of all ages in all hospital areas. Furthermore, delirium can lead to frequent complications for these patients, especially those in the intensive care unit. Delirium has negative outcomes from those suffering from it. They include higher inpatient post-discharge mortality, increased length of stay, delayed or limited recovery of physical function, and a higher probability of placement into a skilled nursing facility. In the surgical intensive care unit where this project was implemented, the average number of patients suffering from delirium is about 23%. The purpose of the project was to address the effects of 4 times a day assessments versus per shift assessments or twice daily. That's already the standard of care in the SICU. More specifically, the purpose of the project was to see if these more frequent assessments would lead to a decreased incidence in delirium. This led to the formation of the PICO question: what are the effects of CAM-ICU delirium assessments being performed 4 times a day on patients in the SICU compared to delirium assessments performed twice a day? So this project is a quality improvement project. The patients were assessed 4 times a day using the CAM-ICU delirium assessment. The results were recorded onto a piece of paper, and then we later transcribed them into an Excel form using 0 for patients that were not delirious, 1 for those that were, and 2 for those that were unable to be assessed. The results were averaged at the end of each month and at the end of a 4-month period to determine if the more frequent assessments had an effect on the incidence of delirium. The project's implementation and design was influenced by Deming's PDSA model, the Plan, Do, Study, Act model. This model is used to implement changes quickly and efficiently within an organization. A review of the literature was done. Should be noted right off the top that there's very little research into the most efficient frequency of delirium assessments that should be done. There were some articles that used 2 and 3 times a day, and some that only limited it to 4 days at a time. But what is really clear is that despite the recommendations of professional societies and patient safety organizations, most ICU patients worldwide are not routinely monitored for delirium. This prevents prompt prevention and management. Guidelines, also guidelines on the use of pharmacological agents or sedatives for delirium patients and those that are critically ill note that they shouldn't be used. They recommend non-pharmacological interventions. There are 3 main types of delirium assessments: the confusion assessment method, the delirium observation screening, and the Nealon and Champagne confusion scale. For this project, the CAM-ICU was chosen because of its superior sensitivity and specificity. And fortunately enough, the nurses in the unit were already using this, so they were familiar with it. So this is an example of the CAM-ICU assessment that was used during the project. It has all 4 features: alteration and fluctuation of mental status, alteration and fluctuation and level of consciousness. It looks at disorganized thinking, and it also looks at inattention. This is a graph that shows the total number of patients that were assessed during our project. That's the top line in the green and the gray. The middle line in the orange are the patients that tested positive during the 4-month period. And the bottom line in the blue are the percentages of positive patients. Once we've collected all the data, we used a Fisher's exact test to determine the level of significance for the project. As you can see here, for the 2-day assessments, our total number of patients ended up being 486, with 380 of them being not delirious and 106 of them being delirious. For our 4-day assessments, which happened over the 4-month period, we had a total of 342 patients assessed. 285 of those were not delirious, 57 of those were. So the outcomes of the project, throughout its implementation, the diagnosis of delirium dropped from 25% in January to an average of 16.7% over a 4-month period. The project's results showed that the increase in the frequency of the CAM-ICU assessments to 4 times a day yielded an average of 5.3 to 8.3% decrease in delirium incidence. It should be noted, though, that the project's significance, it was not statistically significant. We ended up with a p-value of 0.07. I think it's important to note, though, that if given more time and more patients assessed, the significance will become greater. I think it will eventually have a p-value of 0.05 or less. So conclusions, the project showed that more frequent delirium assessments positively affected the incidence of delirium within the SICU. The average incidence of delirium dropped from 25% in January to an average of 16.7% over a 4-month period. That's an 8.3% average decrease over the 4 months that the patients were assessed 4 times a day. The project also brought more attention to the subject of delirium. It also sparked conversations about ways to further decrease delirium incidence. This has led to providers in the unit being more cognizant about when they order labs and other diagnostic tests, and the nursing staff has become more diligent in the performance of the CAM-ICU assessment. So here are some references that were used during the making of the manuscript. I'll provide them all here. And I'd like to thank you all for listening to the project. I hope you all have a wonderful day.